Have you ever felt a burning pain in your upper stomach, especially when you're hungry, and someone just told you, "Oh, it's just gas"? What if I told you that this pain can start as a simple irritation, and if you ignore it, it can slowly turn into a real wound inside your stomach? Today on Easy Medics Daily, we're going to break down gastritis and peptic ulcer disease simply, clearly, and correctly. Welcome. By the end of this video, you'll understand what gastritis really is, how it progresses into ulcers, the real causes, and not the myths, the warning signs you must never ignore, and how treatment actually works. So stick around. First, let's understand the normal stomach. Your stomach produces incredibly strong acid, strong enough to digest meat. So, why doesn't it digest itself? The secret is a protective mucus layer, which acts like a wall between the harsh acid and the delicate stomach lining. As long as this wall is intact and strong, the acid can do its job safely without causing any harm. It's a perfect balance. So, what is gastritis? In simple terms, gastritis means inflammation of the stomach lining. Imagine that protective wall we just talked about. In gastritis, this wall becomes irritated, weak, and inflamed, but it hasn't broken down completely yet. The most common causes worldwide are an infection from a bacteria called H. pylori, and the frequent use of painkillers known as NSAIDs, like aspirin, ibuprofen, or diclofenac. Other factors like heavy alcohol use, severe stress from a major illness or injury, and smoking can also contribute. At this stage, the wall is damaged, but there is no open wound yet. Many people tend to ignore gastritis because the symptoms can be quite vague or mild. You might feel a burning discomfort in your upper abdomen, some nausea, a sense of bloating, or you might feel full very quickly after starting a meal. Some people even lose their appetite. And here's the tricky part. Some people with gastritis have no symptoms at all. They're completely unaware that the irritation is happening. Now, here is where the real danger lies. If the cause of the gastritis isn't identified and treated, the stomach acid continues its attack on that weakened, inflamed lining. Day after day, the damage gets worse. Eventually, that protective wall breaks. That break is called a peptic ulcer. It's the critical turning point from simple inflammation to an actual wound. So, what exactly is a peptic ulcer? A peptic ulcer is an actual open wound, a sore, in the lining of your stomach, which we call a gastric ulcer, or in the first part of your small intestine, which is called a duodenal ulcer. This is no longer just irritation. This is tissue loss. The acid has literally eroded a hole through the protective layer and into the stomach wall itself. It's the difference between a sunburn and a deep cut. Naturally, the symptoms of a peptic ulcer are usually more severe and more specific than gastritis. The classic symptom is a burning or gnawing pain right in the upper middle part of your abdomen. The pain often has a relationship with your meals. If the ulcer is in your stomach, the pain might get worse right after you eat. But if the ulcer is in your duodenum, the pain might actually get better when you eat, but then come back with a vengeance when your stomach is empty or even wake you up at night. Nausea or vomiting can also occur. Now, listen carefully. There are some danger signs that you must never ignore. If you notice black terry-looking stool, if you're vomiting blood or something that looks like coffee grounds, if you feel extremely weak and dizzy, or if you suddenly experience a severe sharp pain in your abdomen, you need to seek medical care immediately. These can be signs of serious complications like bleeding or a perforation, where the ulcer has burned all the way through the stomach wall. These are life-threatening emergencies. Let's bust a common myth. Many people believe that stress alone causes ulcers. The truth is, while severe emotional stress can worsen the symptoms and delay healing, the vast majority of ulcers are caused by two main culprits: that H. pylori bacteria we mentioned earlier, and the long-term use of NCD painkillers. Stress is rarely the root cause all by itself. So how do doctors figure out what's going on? They usually start by listening to your clinical symptoms. Based on your story, they might test you for H. pylori, which can be done through a breath test, a stool test, or a blood test. In more severe, chronic, or concerning cases, they might recommend an endoscopy. That's a procedure where a thin camera is used to look directly at your stomach lining. Not every stomach pain needs a scope, but some definitely do. The goal of treatment is to target the cause, not just cover up the pain. The core pillars of treatment are, first, medications that reduce stomach acid, like proton pump inhibitors, or PP is. Second, if H. pylori is present, a course of antibiotics is essential to eradicate it. Third, stopping NSAIDs whenever possible. And fourth, making lifestyle changes, like reducing alcohol consumption and quitting smoking. Just taking anticides on their own will only give you temporary relief without fixing the underlying problem. So, here's the final take-home message. Gastritis is the warning stage. It's your stomach telling you that its protective shield is failing. A peptic ulcer is the consequence of ignoring that warning. Don't wait for the problem to get worse. Early and proper treatment can heal the lining, relieve your symptoms, and most importantly, prevent dangerous complications. If this video helped you understand your symptoms better, please share it with someone who always dismisses their stomach pain. And for more simple medical knowledge that could save a life, make sure you subscribe to Easy Medics Daily. Thanks for watching.